Hi, I'm Lori Wengerd of Home Care Assistance. Welcome to Live at Lunch. I am here with Dr. David Hinkle from Ohio Health, Riverside, and you are a movement disorder specialist.
That's correct.
And we're here because it's Parkinson Awareness Month. But when I hear movement disorders, I know it's more than just Parkinson's. So what kinds of diseases do you work with or conditions do you work with?
The name of the field kind of describes it. It's any type of movement problem that people have. So Parkinson disease and disorders like it will have tremors, slowness of movement, stiffness of muscle tone, walking problems. There are a wide variety of tremor disorders that are different than Parkinson disease, that have kind of different underlying etiologies and different management approaches. There are conditions called dystonias where the brain is having trouble telling the arms and legs to relax, and so people might have kind of twisty movements. There are disorders called choreas, which have kind of wiggly, dancy movements that people can't control. So Huntington disease was once called Huntington chorea, but has other features, so the chorea has been removed. Myoclonic jerks or quick jerks that interrupt movements. Walking disorders of various types that may not fit into those categories. Tic disorders, Tourette's disorder, usually in younger people that have kind of twitchy movements that are sort of under their control. So it actually is a very, very broad, and there are some that I haven't mentioned. So it's a very, very broad field. It's an interesting field. It's a difficult field, but fortunately, there are things that we can do to help these folks with different types of therapies. And although we're lacking on cures right now, we have a lot of things that we can do to help people to kind of stay engaged in their lives in multiple ways.
That's important. So to those of us, the untrained eye, they can all kind of look like there's something wrong, and we might assume it's Parkinson's. Is there something that those movement disorders have in common?
Well, I guess the quick answer to that is that they are, people can tell. I mean, I talk with my patients. I can tell that I'm getting older. I'm not as strong as I used to be. I can't run and jump like I used to. And a doctor may look at me and push and pull and say, "Oh, you're fine," but I know that something has changed. And so people will recognize my handwriting is different, or my arm twists, or my arm wiggles, or my face kind of twitches to the side or something. So I think that the quick answer is there's some change in either a person's capacity to control their movement, or there's something happening that's positive, a twitch or a jerk or a tremor that they notice is just not right, and they're usually pretty savvy that something has changed. So that would be how I would answer that. Sure.
So since we are talking about Parkinson's, where does that disease fall on the, I guess I would call it the hope scale?
I guess there are a couple ways to answer that. We don't have a cure yet for Parkinson's disease. One of the reasons I think is that it's a decades-long disorder for most people. We would really like to know what's happening in the early stages. That's where the kind of the initial pathology is occurring, and we just can't take brain biopsies. We can't get in there and look at what's happening. We know a lot about what the brain looks like when a person is finished using it. So when a person goes to autopsy, we know what it looks like, but those are the cells that have survived the 40 or 50 years. And so we know it's not as informative about early on. So I would say the cautious side of that answer is that we don't have a cure yet. It would be nice to have a cure that would be very helpful to people to stop it in its tracks early on. But in terms of our management, that there's a very positive spin on that. As I tell people I work with, 2 generations of doctors ago, I or I would be taught to say, get
You'd be taught
yourself,
to say.
go to a nursing home and get your affairs in order.
Yeah.
Nowadays we say, you need to get to a gym, you need to exercise, you need to keep traveling, keep doing your thing, because there are lots of things that you can do and that we can do to help you to keep living a fun, productive life. So the exercise therapies that we do, physical occupational therapy approaches, and our symptomatic medications can be folded together to really help people to stay engaged with their life and their lifestyle. Also, on the positive side, scientists have learned a lot in decades about the genetics of Parkinson's disease and how that fits in with the pathology that we see. And although past approaches to disease-modifying therapy haven't panned out, there's a new set of ideas and paradigms over the last 5 years or so that are now being looked at in early trials, and maybe those will be the approaches that hit. So people can do well with this disorder as long as they keep doing their thing and they work with with the people that are working to help them. So that's, I would say, on a hope scale, it's going up.
It's getting more hopeful.
It's getting more hopeful, exactly.
So you shared quite a bit with me about the treatments, and I'm glad to hear that there's hope in that area. Mm-hmm. But people who don't have the disease or worried about the disease will ask often, well, how do you get it? Like, what causes it? Can you help us with that? Is there anything you know about that?
I probably only get asked that 3 or 4 times a day. So.
And probably from friends and family and neighbors and everybody else who's worried about it.
So, there are maybe 5% or so clearly genetic cause, and then the rest is considered sporadic, so it's happening, we don't know why. But I think what will happen over time as we learn more and more about it, we'll recognize that it's both genetic and environmental and a mix. Okay. And so, my brother and I have similar genetic characteristics, but whatever is happening in my brain may protect me until I'm 60 from getting Parkinson's or Alzheimer's, but whatever is going on in his brain will protect him until he's 160. And since he probably won't live that long, he'll never get it.
Oh, interesting.
I point out to people, I point out to people, if I look at someone's family picture, I know they're all related because they kind of look alike, but I know which one's Cousin Joe and Uncle Jimmy and all of that because there are little differences. So I think that's why there are different tolerances or propensities towards the disease. In terms of what causes it, we still don't have a great idea because, again, when I see someone in the office who's 60 years old who has a little bit of a tremor or a little bit of slowness of movement, we can't go in and biopsy that. We don't have high precision imaging that tells us what's happening. We don't know what's happening in the early stages. If we knew that, if we could get to that, that would help us a lot in terms of what's happening. We know decades down the line what things look like, but we don't know what's happening early on.
Yeah.
I tell
what
people
before that.
Well, that's right. Yeah. And they're based on autopsy studies of people who died without Parkinson's disease. A number of them actually do have the pathology of Parkinson's disease, so they probably would be developing it would have developed it had they lived long enough. So we do have the sense that Parkinson's is probably going on in the brain for 5 to 10 years before it's clinically apparent. So even to that degree, we're jealous of dermatologists who can, you got something there. We're going to take it and look at it under the microscope, grow it in a culture dish, and not that their job is easy. Yeah. So if there are dermatologists out there, I'm not saying anything, but we just don't have access to the tissue at that stage. So
that's so well put.
Quick answer is we don't know. Yeah. We have ideas, but it's hard to get at what we need to know, and that's where that's why the cure has been a little elusive, and the animal models based on toxin exposure from the environment, things that have been epidemiologically correlated with Parkinson's haven't really panned out. And the treatments that were used that would cure the animal model didn't help the human model.
Oh boy.
And so it's even been difficult to model in the lab.
Yeah.
And now people are using much more of the genetic approach to get more of the human condition to work
And
on
not just looking for that quote Parkinson gene, but things that might impact other
nature nurture gene environment interaction, and to add to that, there are probably many forms of pathology that cause what we call Parkinson disease. So it's just everyone has their own experience with it and little nuances that are different. So
is it hard to be in a field that has a lot of more questions than answers?
Not now.
You've done it long enough.
Yeah, I'm still nervous that I miss things, or that
I'm sure, yeah.
that that never goes away. But I have learned much more with time what nobody knows yet and what I don't know, and there was a senior neurologist wrote about 2 years ago that becoming comfortable with the unknown and being comfortable with your discomfort is an important part of doing this job, because as I tell my kid, Dad didn't invent the machine that he's trying to work on.
Yeah,
it's a very complex computer that has no manual, and we didn't build it. But with time, with time, you kind of know the boundaries, and you know when to ask other people for help. And there are papers and books to go back to and look into, and you kind of get a sense of where we're kind of getting to the fringes of what we know. And people actually are pretty receptive to that. I've found over the years that
not frustrated.
Telling people, I'm going to do the best I can. We're going to work on the treatable things. We're going to look into what we know. We're going to rule out dangerous things. That people respond to that rather than, I'm the doc, I know everything. And I wish
I have the answer.
I wish the white coat. I wish I could just download files of everything and just know it all. But that's not. In any profession, I think everybody knows that experience is gained, and that we.
I love your outlook. That's really
it's a way to also, on my side, it's a stressful job trying to help people that have a disorder that I don't completely understand and that we don't have a fix for, and trying to help them to work through it and teach them about it with gaps in knowledge. And so kind of as a physician, as a human physician, I give myself a little bit of a break. Well, you didn't create this. This is you're helping them
Good
to
for
work
you.
with some. Well, it's
you're doing what you
it's
can.
It's something you can take home and churn on all the time. But there are ways. I think every person in their profession finds ways to kind of do the best they can, but work within reality.
Yeah, we see it too, right? We work with a lot of people till the end of life, and feeling that we're with them in their most vulnerable moments, and that's a blessing for us. It's the way that we have to do it. So. This was such a good conversation with Dr. Hinkle that we're going to break it into 2 parts so that we don't have to edit any of it out. Thank you for joining us for part 1. Stay tuned for part 2.